Hello everybody, in this video lecture we will cover chapter 7, the skeletal system. Please keep in mind that most of the material from this chapter is covered in your lab video lectures. So please check Canvas for lab video lecture updates on the topic of the skeletal system. So we already know that skeleton is divided into axial skeleton and appendicular skeleton. And the axial skeleton consists of 80 bones and 3 major regions: skull, vertebral column, and thoracic cage. On this diagram, part of the skeleton is colored in blue color, blue or green. I'm sorry, I might be colorblind. So I will call it blue. And part of the skeleton is colored in yellow. So this blue color includes skull, thoracic cage, and vertebral column, and this is axial skeleton. Yellow bones are bones of your upper extremities, low extremities, pectoral girdle or shoulder girdle, and pelvic girdle or your hip bones, right? Those bones are part of the axial skeleton. And in our lab lecture, I covered all these bones in details, and you also can find the complete list of all the bones and the features that you need to know for your exam also on Canvas. Paranasal sinuses. Paranasal sinuses are mucosa-lined air-filled spaces, and they function in making skull lighter, enhance a resonance of voice, and sinuses are found in frontal, sphenoid, ethmoid, and maxillary bones. So on this diagram, you can see anterior and medial aspect of these sinuses, and we call them paranasal sinuses because they located around your nasal cavity. Right, so here's the frontal sinus in the frontal bone, ethmoidal sinus in the ethmoidal bone, in ethmoid bone, sphenoid sinus in the sphenoid bone, and maxillary sinus in the maxillary bone. Vertebral column. Here we're covering only curvatures. Again, I'm reminding you that's just some material. We're not talking about individual bones in this lecture. All individual bones and their features are covered in our labs. So vertebral column curvatures. Curvatures increase the resilience and flexibility of the spine. We have 2 posteriorly concave curvatures, cervical and lumbar, and 2 posteriorly convex curvatures, thoracic and sacral. So humans are the only animals that have all these 4 curvatures. We are the curviest animals in our animal kingdom. Plus, some curvatures of the spine can be abnormal. If it's abnormal lateral curve, we call it scoliosis. If it's abnormal thoracic curve, it's kyphosis, and lordosis is abnormal lumbar curvature. So over here you can see vertebral column, and vertebral column is made of a vertebra. Some of these vertebrae are fused, like in the sacral region and in the coccyx. We have in the sacral 5 vertebrae fused together and 3 to 4 vertebrae also fused that form coccyx. The rest of the vertebrae, they can move, and we have 24 of these movable joints, right, and vertebrae. And vertebral column is divided into segments. Cervical segment, right? Cervical area, I would say thoracic area, lumbar, and sacral and coccygeal. And when we want to identify specific vertebra, we use letter and number. So in the cervical region, we would have 7 cervical vertebrae, C1, C2, C3, and so on through C7. So C1, C7, that's a cervical vertebrae. In the thoracic region, we have vertebra named T and numbers, T1, T2, T3, through T12. So we have 12 thoracic vertebrae. In the lumbar, we have 5, and we abbreviate it with letter L, L1 through L5. There is a mnemonic to remember those numbers, and mnemonic is the following: breakfast at 7, lunch at 12, and dinner at 5. So 7, 12, 5. And here you can see the curvature, right? So we have cervical curvature, we have thoracic curvature, lumbar, and sacral. So here's 4 curvatures here. On this diagram, you can see abnormal pathological curvature of the spine, lateral scoliosis, kyphosis, thoracic region, and lordosis, lumbar region. So kyphosis is common in older people, especially in females, and it can be a sign of osteoporosis. Lordosis at some degree present in pregnant females, and then it's not considered to be pathological. Also, if female is wearing high heels, it's also create a little bit extra curve in the lumbar region that also not considered to be pathological. It's only when it's at extreme degree that it might cause different problems. And we're also gonna very briefly discuss ligaments of the vertebral column. So we have anterior longitudinal ligament, right? So if you look at this diagram here, that's anterior part of the vertebral column. So that's anterior longitudinal ligament, and behind is posterior longitudinal ligament. We also have ligamentum flavum, and ligamentum flavum connects adjacent vertebrae. So you can see it's right here. And different short ligaments that connect each vertebra to those above and below. Between vertebra, we have a structure called intervertebral disc, and it's cushion-like pad composed of 2 parts. So you can see these 2 parts here represented in lighter blue and darker blue. So right in the middle, this is called nucleus pulposus, and nucleus means something in the middle, right? That's how the word nucleus pulposus came to. So it's inner gelatinous nucleus that gives the disc its elasticity and compressibility. And annulus fibrosus is outer collar composed of collagen and fibrocartilage. Annulus means circle, like annual, changes, something that happen all year around, right? So annulus means circle, and fibrosis tell us that we have lots of collagen in this structure. So in this diagram, you can see these ligaments and intervertebral disc that we just discussed. So here, anterior longitudinal ligament. On the back side, it will be posterior longitudinal ligament. We have ligamentum flavum that connects vertebra to each other. And here is not shown any short vertebra, but we have many short vertebrae that connect, ligaments, short ligaments that connects adjacent vertebrae to each other. Also, you can see intervertebral disc over here. So appendicular skeleton includes, as I already said, pectoral girdle, pelvic girdle, and bones of the upper limbs and lower limbs, arms and legs. So bones of the limbs and their girdles. And girdles are bony structures that attach arms and legs to the axial skeleton. And on this diagram, you can see that the pectoral girdle, and it's made of two bones, clavicle and scapula, and the pelvic girdle shown here in red. This is our hip bones. Now, also, pelvic girdle is not the same as pelvis, because pelvis is not part of appendicular or axial skeleton. Pelvis is both, right? Because pelvis include hip bones and it's also include sacrum. So sacrum is part of the axial skeleton, and those hip bones are part of the appendicular skeleton, right? So do not confuse pelvis and pelvic girdle. Now, pelvic girdle, as I already said, it's made of hip bones. These hip bones are three bones fused together, ilium, ischium, and pubis. Another name for hip bone is coxal bones or os coxa. So in this slide, we're gonna compare male and female pelvises. There is very many characteristics that allow us to distinguish between male and female pelvis. Here we have some of them. So bone thickness in a female is lighter, thinner, and smoother, and in a male it's heavier, thicker, and more prominent markings are present. Now, if you look at the pubic arch, and pubic arch is right here, right, this angle, right, and in a male is this pubic arch angle is 80 and 90 degree. In a male is smaller, so the angle here is about 90 degree, or if it's less, if it's 50-60, then it's a male pelvis. So acetabulum is this socket where we form a joint with the femur, right? So the head of the femur fit in the acetabulum, and in a female it's small and further apart, and in the male is large and closer together. Sacrum in a male is wider, shorter. Sacral curvature is accentuated, and in a male the sacrum, and that's a sacrum over here, right? So that's a sacrum. It's a narrow, longer sacral promontory is more ventral. Coccyx more movable and straighter in female, and less movable and curves ventrally in male. So on the next slide, we will actually see two pelvises. But before we do this, I want you to look at this picture and just kind of have this idea, what do we call false pelvis and true pelvis. So this like bony structure making like oval part over here, that's called pelvic brim. So all the parts of the pelvis that above this pelvic brim is false pelvis. So actually there is no any pelvic organs in this area, right? Except of urinary bladder, and only when it's full. All the pelvic organs located below this pelvic brim that is called true pelvis, right? So So we have this opening, right? That's called inlet, pelvic rim. So that's inlet of the pelvis. So everything above is a false pelvis. Everything below is true pelvis. So here on this diagram, we can see that you can see pelvic arch here, right? And this is 90 degree or even maybe a little bit more, but this is 50, 60 degrees, right? So that's a male pelvis. Now you can see the difference in the sacrum over here. Sacrum is longer, right? And the kind of like outlet here is has a lot of obstructions, right? So that space is not that nice and broad. Also, yeah, something right, bone thickness here, pubic angle, acetabulum. So that's pretty much everything that we cover in our previous slide. Just here you can compare these two structure together, female and male pelvis. Now, arches of the foot. So arches are maintained by interlocking foot bones, ligaments, and tendons. And arches allow the foot to bear weight. Actually, without arches, it would be very difficult for us to walk. It will cause a lot of stress to the spinal cord, right? So people with flat feet, they have very often problem with back pain. So we have three arches: lateral and medial, longitudinal, and transverse. So on this diagram, you can see our three arches. This red arrow shows the transverse arch, and green one is a lateral longitudinal because that's a lateral side, and blue one show us the medial longitudinal arch. Developmental aspects and fetal skull. Infant skull has more bones than the adult skull. Skull bones such as mandible and frontal bones are unfused. At birth, skull bones are connected by fontanelles, and the fontanelles are unossified remnants of fibrous membrane between fetal skull bones. So if you guys remember, when we talk about ossification during embryonic development, we mentioned two types of ossification. One of them is intramembranous ossification, and bones of the skull are formed by intramembranous ossification. That means that we start with the fibrous membrane, right? And then those mesenchymal cells, they differentiate into osteoblast, and they start secrete bone, right? So that's how we replace membrane with a bone, right? So part of those bones, right, they are not, part of this membrane is not ossified, and it stays as a fontanelles in embryo and at birth, right? And the function would be, well, first it's allow baby, right, fetus to pass through the birth canal without damaging the skull. So because we have this fibrous membrane between the bones, it allows the head of a baby to squeeze a little bit so it can feed through the birth canal easier. And then at the first couple months of development, the brain really increases in size a lot, and those fontanelles give us extra space for brain to grow within the skull. Imagine if the baby was born with already fused bones, baby would not have any room inside the skull, inside the cranium, for its brain to grow. Right, so we have four fontanelles: anterior, posterior, mastoid, and sphenoid. And you do need to know those fontanelles also for your lab exam. and I didn't show them when I cover a lab video lectures, right? Because I didn't have a fetal skull. So make sure you pay attention to the next page and you know where those fontanelles are located. So here on this diagram, we can see superior and lateral view of the fetal skull, and here are all the fontanelles that we need to know. Anterior, right, that's anterior, then posterior will be over here, and mastoid fontanelle is right here, and sphenoid over here, or sphenoidal, because this bone shown here in pink, right, that's a sphenoid bone. Right, and this is a temporal bone, and you know in adults we have a mastoid process over here, right? But here we have mastoid fontanelle yet, and you can see how the maxilla and mandible, they have very different shape compared to the adult skull. At birth, the cranium is huge relative to the face. At 9 months of age, cranium is half of the adult size. So can you imagine it, right? 9 months of age, when the baby is still very small, the cranium already half of the adult size. So mandible and maxilla are foreshortened. So that means, you know, they're not projecting to the front that much, but then became longer with age. The arms and legs grow at a faster rate than the head and trunk, leading to adult proportion. Actually, if you have a baby, or you have your niece or nephew, or you know any little, really like little infant or toddler, you can ask them to raise their hands, and you can see how shorter their hands are in the proportion to other body parts compared to adult proportions. When the baby just born, they wouldn't be able even to scratch their head on the very top, because they cannot reach the top of their head. That's how big their cranium is and how shorter their arms and legs are compared to adult proportion, but then they in arms and legs, they grow faster. So also when we are born, we're born with the primary curvatures only, and it gives us this C shape, right? And the primary curvature would be thoracic and sacral, and they convex posteriorly. So on this slide, you can see this is the primary curvature, right? And when kids start crawling, they start develop the cervical curvature. And when, so this one, and when then they start walking, they start developing lumbar curvature, and they convex anteriorly, right? So so that's anterior side. So look, this is convex on anterior side, and this is convex on anterior side, and this one convex on the posterior side. And convex, it look like a pretty much like this, like letter C, right? So cervical and lumbar convex anteriorly and appear as child develops, when child learn how to lift his head and learn to walk. We also have some changes with older age. Intervertebral discs become thin, less hydrated, less elastic, and risk of disc herniation increases. Loss of stature by several centimeters is common by age 55, so we are getting a little bit shorter when we getting older, but not like, you know, older by age of 55. Costal cartilages ossify, causing the thorax to become rigid, and all bones lose their mass, right? So that that's it for this video lecture. This was our last slide. So make sure you watch all the video lecture that are related to axial and appendicular skeleton that I cover in our lab video lectures. Right? So, well, thank you for watching and hope it was helpful.